Hello good people, I hope you're fine. Welcome to today's presentation, which is about hypertension, also known as high blood pressure. So the presentation is in 5 parts. The first part, I'll define what is blood pressure, what is systolic and diastolic blood pressure, and also units used in measuring blood pressure. The second part is about the guideline for categorizing blood pressure. The third part is about the types of hypertension. The fourth part is about the causes or the risk factors for hypertension. And the fifth part is about treatment for hypertension. So let's start with the first part, where I'll define what is blood pressure. Secondly, I talk about the systolic and diastolic blood pressure. And finally, in the first part, I'll talk about the units used in measuring blood pressure. So blood pressure is the force or pressure which the blood exerts on the walls of the blood vessels. And it's important to note that blood pressure is represented by two numbers. So in my first reading, 120 is the first number, which is systolic, 80, which is diastolic, the second number. In my second reading, 120 is the top number, which is systolic blood pressure, and 80, which is diastolic. And what are diastolic and systolic blood pressure? So systolic blood pressure is the arterial pressure when the heart is contracting, and diastolic blood pressure is the arterial pressure when the heart is relaxing. And most of the time, blood pressure is measured in brachial artery in the upper arm. And the units used in measuring blood pressure is millimeters of mercury. Now, secondly, let's talk about guideline for categorizing blood pressure. So in guideline, first I'll talk about the normal systolic and normal diastolic blood pressure. Second, I'll talk about the elevated systolic and elevated diastolic. Then stage 1 hypertension, and finally stage 2 hypertension. So normal systolic blood pressure is defined as less than 120 mm of mercury, and normal diastolic blood pressure is less than 80 mm of mercury. Elevated systolic blood pressure is considered between 120 to 129 mm of mercury and less than 80 mm of mercury in the diastolic side. Stage 1 hypertension is between 130 to 139 mm of mercury in the systolic side and between 80 to 89 mm of mercury in the diastolic side. Finally, stage 2 hypertension is defined as 140 mm of mercury or higher in the systolic side and 90 mm of mercury or higher in the diastolic side. Now let's talk about the types of hypertension. So first I'll talk about primary or essential hypertension. Then secondly, I'll talk about the secondary hypertension. So let's start with the primary or essential hypertension, which accounts for about 90% of all hypertensive cases. And primary or essential hypertension has no identifiable medical cause. But we have risk factors which are associated with primary or essential hypertension, which includes old age, obesity, high salt diet, smoking, excessive alcohol intake, and lack of exercise. Now, let's move to secondary hypertension. Unlike primary hypertension, which accounts for about 90%, secondary hypertension accounts for about 10% of all hypertensive cases. And secondary hypertension also has a specific underlying cause for elevation in blood pressure, which may include narrowing of the renal arteries. The first cause for secondary hypertension, we have narrowing of the renal arteries. The second one, we have renal parenchymal disease. Third cause, pregnancy. Fourth cause is about diabetes. Then polycystic kidney disease, renal artery stenosis, chronic kidney disease, and coarctation of the aorta. Now, finally, we want to talk about treatment for hypertension. So the first choice of treatment for hypertension is lifestyle changes such as stress reduction, doing regular physical exercise, eating low salt diets, smoking cessation, and limit alcohol intake. In addition to lifestyle changes, there's use of antihypertensive medication. So thank you for watching. I hope you have enjoyed our today's presentation about hypertension, also known as high blood pressure. So let's meet in our next presentation. Have a good day. Bye.